Hello, everyone, and I welcome you all to this session of 30 Reasons Why You're Closer to Publishing Than You Think. A very warm welcome to all the exciting, passionate individuals who have joined this meeting here. Myself, Sabresh Iyer, a final year MBBS student and the senior council co head of M.I.C.E, and I extend a warm welcome to everyone who is present here. In this era of increasing awareness about research, increasing awareness about academics, one very highly explored area, not just by students, but also by clinicians, by consultants, and everyone is research. But in this generation, the amount of guidance and the amount of requisition that is needed in order to conduct research is highly spellbound. And in order to bridge that gap, MySlab, along with Clinically Evolves, brings to you the series of 30 Reasons Why. Because attending long, boring lectures in this era has never appealed to anyone. And here we are bringing you a series of exciting episodes with interaction and fun activities so that you also can do research, you also can get your names published in one of the journals out there. Before we begin this season, that is season one, let me introduce you to the organizers of this session. Firstly, MICE which stands for Medical Innovation, Creativity, and Entrepreneurship, fosters a collaborative environment among young, tech savvy medical students who can pair their passion for patient care with innovative thinking, with the aim to empower the next generation of healthcare leaders. Our mission at MICE is to provide all the possible opportunities to anyone who asks for it to enable them to develop solutions that improve not only patient outcomes but also revolutionize the way healthcare is viewed on a global scale via interdisciplinary collaboration. You can follow my labs on Instagram and LinkedIn to know more about such interesting events that we conduct all across for all the MBBS students. The next in line is Clinically Evolved. Clinically Evolved is an academic medical organization who dedicates themselves to advancing healthcare education through research and patient care. With the motto of chasing excellence in skills, we aim to focus on the development of clinical skills, building a community of academically oriented medicos, and work towards a common vision of advancing healthcare in India and worldwide. So, CE, along with my class, brings to you 30 reasons why. And this is the pilot episode. In this episode, we will be talking basically about what is even medical research, because the main aim of this season is to start at the baseline, and when the seasons end, you are on one step higher and one step closer to publishing yourself. In season one of in the first episode of season one, we are grateful to welcome Dr. Kunal Shah. Dr. Kunal Shah has been a pioneer in the field of research. As a part of the state subcommittee of IMA MSN, Dr. Kunal has extended his arms wide and far in the field of research, having various publications to his name, such as the awareness of malaria vaccinations in India, assessment of occupational health hazards and associated morbidities in the sanitation workers of metropolitan cities. Dr. Kunal Shah is currently a medical intern at Dr. Hindu Hriday Samrat Balasaheb Thackeray Government Medical College and Dr. R.N. Cooper Hospital in Mumbai. And he has participated in various symposia, case presentations, and paper presentations, having numerous accolades credited to his name. Unfortunately, because of his busy schedule and rural area posting, he was not able to join us live on this session. But don't worry, he already has recorded his session in a depth and has given us the recording for us to play on this live session. We apologize to you all for not having him live on this session, but do not worry. In the upcoming sessions and in the upcoming episodes, you will have the speakers live to join along with us. Whatever questions you might have for the speakers, please send us on the group or on our personal messages. We will send across those questions to the speaker, and as and when the speaker answers those questions, we will send across the answers to you so that you yourself are satisfied. As far as 30 reasons why as a academic session goes. After each and every session, you guys will be provided with a post-event form that you will have to fill in order to record your attendance for this session. It will be a short form with few questions that is very much interactive and knowledgeable for you in order to give you an interactive platform as well as for us to have an interesting method of taking an attendance rather than just calling out names and you all guys telling us present. So please make sure that after the session is over, you take out just 15 minutes of your time and fill the form because a time limit of 15 minutes is what will be given to you in order to record your attendance. Post that, we will close the form and it would not accept any responses. So without any further ado, let's get ahead with the pilot episode, What Even is Medical Research? Let's begin.
Hi, thank you, Sabresh. Thank you for the introduction. So I will like to begin with the topic that is given to me. What is research? So, what even is research? Many people are confused as to what would research be. Do I need to be a topper? Do I need to be from a government institute? Do I need to be from a central institute? There are lots of ifs and lots of buts and lots of things in the middle that you all have to figure out. So I would like to take you all through my experience as to what even is research and why you should be doing it. So yeah, next slide. So, research is not just sitting down with your laptop, opening PubMed, and going through a million references and coming down, forming a manuscript. It's much beyond publishing the paper. Now, the publishing of the paper is just a byproduct from everything that you learn in the process. So, you learn things that your textbooks don't teach you, right? Your textbooks will get outdated when new and new updates keep coming in. So, it's better that you do a research presentation, you take part in symposiums, you take part in such competitions so that you're up to date with medical science and what we call continuous medical education. What is medical research? It is when a group of people come together and they think of a topic and then they're actually studying it in depth to come up with an outcome that may have been proven earlier and they would like to disprove that or they would like to come up with an entirely new pilot idea itself. You work with seniors, you work with your mentors, and you come down to a conclusion in the most scientific and specific manner. So there are a lot of scholarships and awards like ICMR the Khurana Scholarship, many institutional grants, and that's when clinical application starts making sense in your real practice. When you'll be sitting in your internship, when you will be in your UHTC, when you will be in your RHTC postings, you'll actually understand that these protocols are given to us. Why to prescribe metformin 500 OD first, and then to go with metformin 500 BD, then to add glimepiride 1 mg. The science behind it, the number of clinical trials behind it, the number of research papers behind it, the number of modifications made to that simple drug, which looks so simple today, that is actually medical science. So, next slide. So, what is the difference between a research and a project? A research is a scientific uh, explanation of a particular topic, and a project is just meant to reflect on your CV, to show the initiative, and that can help you with internships, electives, CVs, etc. That is more of an on paper thing, right? Next one. So why research matters in medical education and practice? As I said, textbooks get outdated fast. There's a new edition of Harrison's that is coming in every 1 or 2 years. It's not just like they're changing a book cover. There are a lot of things. When you call something that is the Bible of education, it has to have all the facts that are put forth and what are actually standard textbooks. It is when a 50-year-old doctor or a 75-year-old doctor or a 20-year-old doctor has read the same information and it's being carried forward from generation to generation. But the facts never remain the same. The facts need to be modified based on research, based on all of this. Now, coming to the interesting part, research actually gives you the edge. Now, consider yourself to be practicing in a particular region. You are, for example, an MS general surgeon, laparoscopic surgeon, and in your region there are 50 different laparoscopic surgeons. You all are going to get variety of cases. You all discuss cases. You all come down together and discuss cases, just like a group of friends. And that is actually done in a conference setting, in a more formal setting, in a more scientific manner. And that's when research helps. It provides and it gives you respect from your profession, from your colleagues. And it's not even about the respect, it's about the change that you make in the fraternity. Because when you see something, when you look at a technique in a particular way, when you think that you can deal with a case in a particular way, that's when research actually matters. And that's how you get techniques to your name. Now this practice starts right from med school, by taking interest in systematic reviews, meta-analysis, in case reports, in letter to the editor, a lot of multiple types of research papers. Now, why it is important is not only for your CV. Whatever statistics you have on your CV is just going to be a byproduct from what is actually going to be useful in medical science in your practice in the future. So, taking part in paper presentations, poster presentations, symposiums, and all of these academic events is going to enhance your CV, is going to help you build confidence for clinical practice in the future. As we learn in AdCom, communication is the most important thing with the patient, with our colleagues, and with the patient's family. So this is something that leads to a lot of character development, a lot of curiosity. And even if you have a random question like, okay, for example, if we know that it's 2025, everyone is scrolling through Instagram, everyone is scrolling through Reels. Now, the one common problem that we all face is, oh, my back is hurting, oh, my neck is hurting. Now, you can find a correlation. Now, it shouldn't be a very novel study. It need not be a very novel study. You can just start right from there. How about checking this in 18 to 25-year-olds? Hey, so how about checking it in medical students? Or hey, how about checking it only in engineering students? So it can be completely, it's your field of play. It's your game. You can play it however you want it. So scientific research has no limits, has no boundaries, but there are a lot of rules that you all be learning in the forthcoming episodes. So what I want to tell you all is develop an idea and develop your mindset to be scientific, to be specific, and to do things that will create long term impact in society. When you are sitting in your OPD and you are attending maybe say 50 patients or 100 patients, some new research can help millions of people, and that's the impact. And that's when you think that you're going to take a lot of time to publish one study, but your 6 months or your 1 year is going to save so many lives. It's going to make things easy for millions of people. So that is the scale of impact that medical research can have, and the practice comes from now. We don't have to do such effective research studies right from this age, right from first year, second year, third year, final year internship, or even residency. You all just have to be in the discipline and the practice of having a scientific mindset. If you come across a very interesting case, you should discuss it with your faculty, you should discuss it with your colleagues, and you should come up with an idea as to let's present this. And that is what I feel as Indians. We need to step forward. We need to build our name and our reputation in research. We have a lot of scope. We have so many intelligent doctors out there, but we need to excel in academia. And that is something that my vision stands for in the future as well. So, yep, it is your currency in conferences and scholarships. It does give you respect. It's not only about, those after parties at your conferences and going to fancy places like the United States and Hawaii and wherever, the UK, Australia, New Zealand, wherever you're going. It's not about those fancy places. It's not about those posts on LinkedIn. It's not about adding them on ResearchGate. It is about the impact. And all of this is the byproduct. So it actually saves you from being replaceable. In 10 years, AI will write better prescriptions than most doctors, is what everyone assumes. But it can't ask new questions. The new questions come from you, come from me, come from all of us, our medical fraternity, because it's us who's going to pivot AI the way it needs to pivot. So ask questions, be curious, and do things that will impact society in the long term. Yeah, next slide. So everyday curiosity turning into research questions. I told you something about neck pain and it being correlated to medical students or engineering students. Now you can also think of, say, carpal tunnel syndrome being more common in software engineers due to their chronic use of mouse and keyboard, and compare it to, say, a sportsman, compare it to a golfer, compare it to a cricketer. They may have different problems. They may have a tennis elbow problem. You compare that with another sport. You compare that with someone who's a footballer. You can compare ankle sprains with say ACL tests. There are a lot of things that can be compared. And comparative study, systematic reviews, meta-analysis, cross-sectional studies at our level, they're going to be very, very useful. So all these are certain examples of everyday questions that can be turned into research questions, research papers. So instead of scrolling through Netflix the next time, you should be sitting with PubMed. You should be scrolling through PubMed, and just be curious, right? Ask yourself questions. And now that you're in the medical fraternity, now that you're a medical student, you're a part of medical education, it's your responsibility to take things forward to the next generation. How do you think the COVID vaccine was made so fast, right? So there is so much funding, so much research, and so much pressure involved to make something so life-saving as the COVID vaccine. So there's tremendous amount of research that is done, and nothing is impossible, right? So we need to be curious right from the start. We need to take part in these presentations and these events. So the more important part will be how to start, what to do, but nobody thinks about why to do it. You need to get your why right. You don't need to look fancy in front of people. You don't need to have a 5-page CV. You don't need to have 100 publications and 200 citations and an H index of 10 on ResearchGate to be relevant. You just need to be curious, and like recognizes like. The real people in academia will know that this research has so much potential and this idea has so much impact. And you publishing 100 papers with something that may not be so useful for medical science. Yeah, next slide. So, common myths about research, it's only for toppers. Absolutely not. In fact, this is a research article in itself. So, is research only for toppers? Right? Now, what is the definition of toppers? The one who bats till the end is a topper. The one who doesn't give up is a topper. So, probably the same qualities are required for someone who is into research. You need to be patient, you need to wait for the results. And you may not even get the desired results after putting in so much hard work. Now, there is you need to come up with a plan. You're going to fail 100 times, you're going to make mistakes in the process, but it's completely okay, and it's not only for toppers, right? I need to know statistics. No, you just need to know statistics that is required and what is expected out of you at our MBBS level. That is pretty much expected. That is a part of our MBBS curriculum, right? So there are many institutes, and your biostatistician will always be a part of your study. He or she will always help you out. So if you want to learn something additional about what has to be done, yeah, of course, you need to know what is a p-value. You need to know what is specificity, and you need to know whatever data you're collecting. Now, what are you doing with the data? Now, what are your parameters of the questionnaire? What are you going to achieve? What is your research question? And how is your data coming down to this conclusion? Has any study already been conducted earlier? Now, what study do you think that can be conducted later? What are the limitation of your study? Now, all of this revolves around numbers, revolves around statistics. Now, in cricket and in football and all the sports that we see and all the popular sports, they play a lot with data. Now, Sachin Tendulkar has scored 100 hundreds. Now, that is data, that is statistics at the end of the day. And these statistics are what brings, is what keeps medical science in check, is what keeps science in place, right? That is what your target is. Now, for example, in India, what is the under 5 mortality rate? What is the parental mortality rate? What is that? It is statistics at the end of the day. So at the end, everything comes down to numbers, and you don't really have to learn everything in depth, but your idea should be such that you know what you're presenting and you know what outcome you want out of this research. You'll have to compromise on your academics to publish high quality articles? Absolutely not. your research is equal to academics, because if you excel in research, you're going to excel in academics, because you'll start questioning why, and you'll not only absorb all the information and then try to vomit it out in your exams. You will ask why, you will understand why, you will think logically, why not this, and if this then what, if not this then what. So all of these questions will come to you, and that's where you will get a lot of clarity, and that's where you will understand what exactly are you looking at, what topic are you exactly looking at, and what you exactly want to do, not only in research but in your profession in general. Publishing a paper without hefty fees is impossible. No, this is a very common myth. We're all students, we're all learning. We know we don't want any financial load on us and our parents. There are open access journals that publish your paper for free. And trust me, when your research article is really, really good, you may not even have to pay a hefty amount, because when people like your topic, as I said, like recognizes like, you may not have to pay APC fees, and you definitely don't have to chase predatory journals as well, the ones who keep emailing and the ones who keep pestering you and saying that, hey, give me XYZ amount of dollars and we'll publish it. You need to stay away from people who are saying that, give me XYZ amount of money and we will get you position number 3, position number 4. There is no shortcut, there is absolutely no shortcut to research, because even if you ask me for any shortcuts, you figure them out the hard way. And what these shortcuts actually are, they are easier way of doing things, which you will understand in due course. But first, my agenda is to get you to your purpose and make you think about why you want to do it. Do you really want to do it just for your CV? Do you really want to do it just because people around you are doing it, or is that it'll make you look cool, or there's any research culture in your college? Well, you need to ask yourself, get your priorities straight, and think about why you really want to do something. And when you're in this medical fraternity, you want to take things forward, you want to take things in your hand, you want your voice to be heard, you want your experience to be shared with the rest of the world, because whatever is there in medical science is open for the entire world to see. And I really want Indians in our country to be at the global stage, and we be the pioneers for a lot of procedures, for a lot of medications, for a lot of drugs that are coming in. Now we're combating a very important problem called ADR, right? So we need something to combat ADR. We need new drugs, we need new research coming in. So yeah, that's about it. And research is only possible if you're from a central institute or a GMC. Well, absolutely not. You just need the drive. You just need to be motivated enough to do a research presentation, to conduct a research, to take part in competitions, and you will be having someone. You will come across someone who is excited enough to help you out, to be a part of your process. Like recognizes like. Always remember that, and start slow. You will figure out your way, and everything else will fall in its place. Take care of the process, the result will take care of itself. When you know your why, your how will be figured out on its own. So that's all from my end. uh, Thank you so much for having me for the first episode. It was an honor to be here. Thank you very much.
Thank you so much, Dr. Kunal, for this wonderful guidance session. I think whatever points as a part of this introduction was required to be known was absolutely clear. And I think these are the pieces that will, in the end, join together in order to put together a successful research paper. Just one question I would like to ask. If someone, after seeing this video, is thinking about taking up research and publishing in the future, what is that single piece of advice that you would give to him or her, which also worked out for you when you started to venture out on this journey of research?
One single advice: don't be afraid of what other people are saying. Don't be afraid of seeing other people's speed in publishing papers. Give yourself the room to fail. No one is born with this knowledge. You are on the pathway of developing all of this, and nothing is easy. You all know how you all have earned your medical college seat. You all have worked very hard. Keep up the same momentum. Medical research is all about resilience, is all about hard work. and you have to replicate the same mindset here. You will fail once, twice, 10 times, 20 times, but there will be one time when you'll get a breakthrough, and then all of those things consolidated will push you to another level, and then there'll be exponential growth right from there on. So you give yourself freedom to fail, and don't judge yourself by looking at other people, and don't let anyone define what you can do and what you cannot do. Just be at your own pace.
To summarize this session, in research, the why matters more than the how. And once you figure out why, the doors to the path of your research will open up on its own. Research is required not just for CVs, but much beyond that. For becoming an astute clinician, you're required to be updated with the guidelines, as it also gives you the edge over others, which not only helps you academically, but also ups your ante in treating patients. Research doesn't require for you to sit and decide a topic for days and months together. Even the common curiosity questions, the basic ones of your daily life, are more researched and cited. It just requires it just requires patience, dedication, which I'm sure you all must have it in you. Finally, the myths which were highlighted are the ones which require you to look beyond in order to successfully conduct a research and fortunately get published as well. For all the questions that are brimming in your inquisitive brains, don't worry and stay tuned with Mice Labs and Clinically Evolve, for there are more number of episodes in season 1 and also for the seasons which are coming up. They are going to be even more exciting, even more interactive, and even more fun. Follow Mice Labs and Clinically Evolve on our social media accounts to be updated on the further seasons and the episodes. After once you leave the meeting, do fill the Google form which will be sent across mindfully and within the time limit of 15 minutes. Those filling the forms only will have their attendance marked. And why do you think the attendance is required? Well, as announced before, those who would actively be attending 25 plus sessions over the 5 seasons will get to be a part of an exciting study of a research cohort with one of the mentors who will be a part of this 30 Reasons Why episodes. For all your questions to be asked to the speaker, do DM us and we'll respond shortly with answers from our speaker. Don't worry, next time you'll get to interact with the speaker himself or herself. Thank you so much to everyone who joined in. I would like to extend a grateful thanks to Mice Labs as well as Clinically Evolved for being the pioneer in starting this very required session for all the people out there who are excited to do research. And for all the viewers, have a great day and thank you so much. Do stay tuned and see you across all the next seasons and episodes. Peace.